5.9 million Canadians currently don't have a family doctor. Let that sink in for a moment. In a country famous for its universal healthcare system, millions of people are now struggling just to find a doctor they can call when they get sick. And it gets even more alarming. Recent surveys reveal that over 52% of Canadian doctors are considering leaving their profession or cutting back their hours because of stress, burnout, and overwhelming workloads. That means the problem may not just continue. It could get much worse. Imagine feeling sick, worried about your health, and realizing there's no doctor available to see you. Emergency rooms are overcrowded, wait times are stretching longer, and many Canadians are now forced to rely on walk-in clinics or online appointments for even basic medical care. The system that once promised accessible health care for everyone is now showing serious cracks beneath the surface. So what exactly is happening? Why are millions without doctors, and why are so many physicians thinking about quitting? In this video, we'll uncover 10 shocking reasons behind Canada's growing healthcare crisis and what it means for the future of healthcare in the country. Stay with us, because some of these reasons might surprise you. Number 1. Massive doctor burnout. One of the biggest reasons behind Canada's growing doctor shortage is burnout. Being a doctor has always been demanding, but in recent years the pressure has reached unprecedented levels. Many physicians are now working longer hours, seeing more patients, and dealing with far more responsibilities than ever before. What used to be a challenging career has, for many doctors, become mentally and emotionally exhausting. A major factor driving this burnout is something most patients never see: administrative overload. Studies have found that doctors can spend up to 30 to 40% of their working hours doing paperwork instead of treating patients. That includes filling out insurance forms, updating electronic records, completing government documentation, and responding to endless emails. Imagine training for over a decade to save lives, only to spend a huge portion of your day behind a computer screen typing forms. Then there's the emotional weight of the job. Family doctors are often the first line of care for patients dealing with serious illnesses, chronic diseases, and mental health struggles. Every day they carry the responsibility of making decisions that directly affect people's lives. Over time, this constant pressure can take a serious toll on their mental health and personal life. The COVID-19 pandemic only intensified this problem. Many doctors worked through extreme conditions, faced staff shortages, and dealt with a massive backlog of delayed medical cases. Even now, years later, the system is still struggling to recover. As a result, many physicians are choosing to reduce their hours, retire early, or leave family medicine entirely. And when doctors burn out and step away, the impact spreads quickly. Thousands of patients suddenly lose access to care, making it even harder for Canadians to find a family doctor. Quick favor before we continue. If you appreciate the research and effort that goes into videos like this, drop a comment below and share your thoughts. And don't forget to subscribe to the channel. It's just one click, but it helps us keep creating videos like this for you. Number 2. Canada's rapidly aging population. Another major reason behind the growing shortage of family doctors is Canada's rapidly aging population. Simply put, people are living longer than ever before, and while that's great news, it also means the healthcare system is facing a huge increase in demand. Older adults generally require more frequent medical care, more medications, and more regular checkups than younger populations. Think about it this way: a healthy person in their 20s or 30s might only visit a doctor once or twice a year. But someone in their 70s or 80s may need medical attention every few weeks or even every month. Many seniors manage multiple health conditions at the same time, such as diabetes, heart disease, arthritis, or high blood pressure. Each of these conditions requires monitoring, prescriptions, and careful medical supervision. This creates a situation where family doctors must spend more time with each patient. Appointments become longer and more complex because doctors aren't just addressing one problem. They're often dealing with several health issues at once. While this type of care is essential, it also means physicians can see fewer patients each day, reducing the overall capacity of the healthcare system. Canada's demographic trends make this challenge even more serious. In the coming years, millions of baby boomers will continue moving into retirement age, dramatically increasing the number of seniors who rely on regular medical care. According to healthcare projections, the demand for family doctors could rise significantly over the next decade, while the supply of available physicians struggles to keep up. The result is a growing gap between how many doctors are available and how many patients actually need care. As the population continues to age, this pressure will only intensify, making it even harder for Canadians to find a family doctor when they need one. Before we move on, we'd love to hear from you. Do you currently have a family doctor, or are you still searching for one? Drop your experience in the comments, and if you enjoy content like this, subscribe to the channel. It takes just one click, but helps us keep making these in-depth videos. Number 3. Too few medical school spots. Another hidden reason behind the shortage of family doctors is surprisingly simple. Canada isn't training enough new doctors. Every year, thousands of talented students dream of becoming physicians. They study for years, earn excellent grades, and prepare for one of the most competitive professions in the world. But despite the demand for healthcare professionals, medical school seats in Canada are extremely limited. In fact, many qualified applicants are turned away every year, not because they aren't capable, but because there simply aren't enough training spots available. Medical schools can only accept a limited number of students due to funding, faculty availability, and the number of residency placements in hospitals. This creates a bottleneck where passionate future doctors are unable to enter the system, even though the country desperately needs them. And becoming a doctor isn't a quick process. After medical school, students must complete years of residency training, where they gain hands-on experience under supervision. This entire journey can take 10 to 12 years or more before a doctor is fully licensed to practice independently. So if Canada doesn't increase training capacity today, the shortage of physicians will continue to affect patients for many years into the future. The challenge becomes even bigger when fewer graduates choose family medicine as their specialty. Some prefer fields that offer more predictable hours or higher pay, which further reduces the number of doctors entering primary care. As a result, even when new doctors are trained, not all of them become family physicians. Without expanding medical education and training opportunities, Canada may continue facing a serious shortage of doctors, leaving millions of patients without consistent access to care. Quick question for you. Do you think Canada should increase medical school seats to train more doctors? Share your thoughts in the comments. We read every one of them. And if you value the effort behind these videos, hit subscribe. It's just one click, but it means a lot to the channel. Number 4. Fewer doctors choosing family medicine. Even when new doctors graduate from medical school, many of them are not choosing family medicine anymore. This has become a growing concern in Canada because family doctors are the foundation of the entire healthcare system. They are usually the first person you see when something feels wrong, the doctor who tracks your health over time, and the one who helps manage long-term conditions. But today, fewer medical graduates are deciding to follow this path. One of the biggest reasons is work-life balance. Family physicians often handle a large number of patients every day, sometimes seeing dozens of people with completely different health concerns. Each appointment may involve diagnosing symptoms, prescribing medications, reviewing medical history, and providing follow-up care. This constant pace can make the job extremely demanding and stressful. Another factor is income differences between specialties. Some specialized fields, like surgery, dermatology, or radiology, can offer higher salaries and more predictable schedules. For many young doctors who have already spent years studying and accumulating student debt, these options can appear more attractive and financially stable. Family doctors also carry a heavy administrative burden, which adds to the pressure. They are responsible not only for patient care but also for managing records, coordinating referrals, and handling insurance paperwork. Over time, this combination of responsibilities can make family medicine feel overwhelming compared to other specialties. Because of these challenges, fewer new doctors are stepping into family practice each year. And when fewer doctors enter this field, the number of Canadians left without a regular physician continues to grow. Family medicine remains one of the most important roles in healthcare, but without better support and incentives, attracting new doctors to this field will remain a serious challenge for Canada's healthcare system. Now we're curious about your opinion. Do you think doctors should receive more support or incentives to become family physicians? Tell us in the comments. We genuinely read them all. And if you appreciate the effort behind these videos, subscribe to the channel. It's just one click, but it helps us keep creating content like this. Number 5. The growing burden of paperwork and bureaucracy. Another major reason many doctors are feeling overwhelmed is the explosion of paperwork and administrative tasks in modern healthcare. While most people imagine doctors spending their day diagnosing illnesses and helping patients, a surprising portion of their time is actually spent sitting in front of a computer completing forms and documentation. Today, physicians must deal with electronic medical records, insurance forms, referral paperwork, prescription approvals, and government reporting requirements. Each patient visit often generates multiple forms that must be carefully filled out and stored. While these systems are meant to improve organization and accountability, they have also created a huge administrative workload for doctors. Research has shown that many physicians now spend several hours every day on paperwork alone. In some cases, doctors may spend almost as much time documenting patient visits as they do actually meeting with patients. This means that after a full day of appointments, many physicians still have hours of administrative work waiting for them. Imagine finishing a long day of intense work and then realizing your job isn't over yet. Many doctors continue completing charts, reviewing reports, and answering messages late into the evening. Over time, this constant administrative pressure contributes heavily to stress, exhaustion, and burnout. Even more concerning is how this affects patients. When doctors are buried under paperwork, they have less time and energy to focus on patient care. Fewer available appointment slots and longer waiting times become the natural result. Many healthcare experts believe that reducing unnecessary bureaucracy and improving digital systems could significantly relieve pressure on physicians. But until those changes happen, paperwork will remain one of the hidden forces pushing doctors closer to burnout and pushing patients further away from the care they need. Now we want to hear from you. Do you think too much bureaucracy is hurting healthcare systems today? Share your thoughts in the comments. We truly value your perspective. And if you appreciate the work behind videos like this, please subscribe. It's just one click, but it helps us keep bringing you content like this. Number 6. The rural healthcare crisis. Another powerful reason behind Canada's doctor shortage is the growing healthcare gap between urban and rural communities. While major cities may still have access to hospitals and medical specialists, many smaller towns and rural areas are facing a serious shortage of physicians. In some regions, entire communities are struggling to recruit even a single permanent family doctor. For people living in rural areas, this can turn basic health care into a major challenge. Instead of visiting a nearby clinic, patients may need to drive hours just to see a doctor. In some cases, families travel long distances for routine checkups, prescription renewals, or minor medical concerns that should normally be handled quickly and locally. One reason for this imbalance is that many doctors prefer to work in larger cities where hospitals are bigger, resources are more available, and professional networks are stronger. Urban areas also tend to offer more career opportunities, better access to education for their children, and more lifestyle conveniences. Working in rural communities can also mean doctors must handle a wider range of medical responsibilities. A rural physician might treat everything from injuries and chronic illnesses to emergency situations, often with limited staff and equipment. This level of responsibility can feel overwhelming, especially for younger doctors just starting their careers. As a result, many rural clinics struggle to attract and retain healthcare professionals. When a doctor retires or moves away, it may take months or even years to replace them. During that time, thousands of residents may suddenly lose their primary healthcare provider. This rural healthcare gap continues to grow, leaving many communities underserved and increasing pressure on already overloaded hospitals in nearby cities. We'd love to hear your experience. If you live in a small town or rural area, how easy or difficult is it to find a doctor? Share your story in the comments. And if you appreciate the effort behind videos like this, subscribe to the channel. It's just one click, but it means a lot to us. Number 7. A wave of doctor retirements. Another major factor behind Canada's growing doctor shortage is something that doesn't get talked about enough. A large number of physicians are approaching retirement. Many of the doctors who built the foundation of Canada's healthcare system started their careers decades ago, and now a significant portion of them are reaching the age where they are ready to step away from practice. In several provinces, healthcare data shows that a large percentage of family doctors are over the age of 55. That means many of them could retire within the next 5 to 10 years. When a physician retires, they often leave behind hundreds or even thousands of patients who suddenly find themselves without a family doctor. For patients, this can be a shocking moment. After years of building trust with one physician, they may receive a letter saying their doctor is retiring and that they will need to search for a new provider. Unfortunately, in many areas, finding another doctor accepting new patients can be extremely difficult. The situation becomes even more complicated when we consider that the number of new doctors entering family medicine isn't growing fast enough to replace those who are leaving. This creates a dangerous imbalance where experienced physicians are exiting the workforce faster than new ones are entering it. Many retiring doctors also say that the increasing workload, paperwork, and stress have pushed them to retire earlier than they originally planned. Instead of practicing for several more years, some choose to step away sooner to protect their health and quality of life. As this retirement wave continues, the healthcare system could face an even larger shortage of doctors, leaving millions of Canadians searching for medical care that may be harder to find than ever before. Now we'd really like to hear from you. Has your family doctor ever retired or stopped practicing, leaving you searching for a new one? Share your experience in the comments. And if you appreciate the time and research behind videos like this, please subscribe. It's just one click, but it truly supports the channel. Number 8. Patients today have more complex health problems. Another reason family doctors are under so much pressure today is that patient health issues have become far more complex than they were in the past. Decades ago, many doctor visits involved treating a single illness or a short-term medical problem. But today, a growing number of patients are living with multiple chronic conditions at the same time. For example, one patient might be managing diabetes, high blood pressure, heart disease, and anxiety all at once. Each of these conditions requires monitoring, medication adjustments, lifestyle advice, and regular follow-up visits. Instead of a quick checkup, doctors often need to spend much more time understanding the full picture of patients' health. On top of that, modern medicine has introduced more treatment options, medications, and diagnostic tools than ever before. While these advancements are incredibly beneficial, they also make healthcare more complicated. Doctors must carefully review lab results, adjust prescriptions, and ensure different treatments do not conflict with each other. Mental health concerns have also become a major part of primary care. Family doctors now frequently help patients dealing with stress, depression, anxiety, and burnout, especially in the years following the pandemic. These conversations are important but often require longer, more thoughtful appointments. The result is that doctors can no longer see as many patients in a single day as they once did. When each appointment takes longer and involves more detailed care, fewer total patients can be treated. This contributes to longer wait times and makes it harder for new patients to find a doctor accepting appointments. As healthcare becomes more complex, the demand for family doctors continues to grow, but the number of available physicians isn't keeping up with that rising need. We're curious about your experience. Do you feel doctor appointments today are more rushed or harder to get than before? Share your thoughts in the comments. And if you appreciate the work behind these videos, please subscribe. It's one simple click that helps us keep creating content like this. Number 9. Barriers for internationally trained doctors. Interestingly, while Canada struggles with a shortage of family doctors, there are thousands of internationally trained physicians already living in the country who are unable to practice medicine. These doctors completed their education and medical training abroad, often with years of experience treating patients. Yet when they arrive in Canada, they frequently face long and complicated licensing barriers before they can work again. To practice medicine in Canada, foreign-trained doctors must go through a strict certification and residency process. This usually includes passing multiple exams, verifying credentials, and competing for a limited number of residency training spots. Even highly experienced doctors may be required to repeat years of training before they are allowed to treat patients independently. The biggest challenge is that residency positions are extremely limited. Every year, many internationally trained physicians apply for these spots, but only a small number are accepted. As a result, some doctors wait years just to enter the system, while others eventually give up and move into completely different careers. The situation creates a frustrating paradox. On one hand, millions of Canadians are searching for a family doctor, while on the other hand, qualified physicians are working in unrelated jobs because they cannot obtain the required licenses. Many healthcare experts believe that improving the credential recognition process and creating faster pathways for experienced international doctors could help ease the physician shortage. With proper evaluation and support programs, these professionals could become an important part of strengthening Canada's healthcare system. Until those barriers are addressed, However, Canada may continue facing the strange reality of having doctors who want to help but cannot legally practice. Now we want your opinion. Do you think Canada should make it easier for qualified international doctors to practice? Tell us in the comments. We really want to hear your perspective. And if you appreciate the effort behind these videos, subscribe to the channel. It's just one click, but it helps us keep producing content like this. Number 10. The lasting impact of the COVID-19 pandemic. Finally, one of the most powerful forces behind today's healthcare crisis is the long-lasting impact of the COVID-19 pandemic. While the worst of the pandemic may seem behind us, its effects on the healthcare system are still being felt every day. For many doctors, those years were some of the most stressful and exhausting of their entire careers. During the pandemic, physicians were suddenly pushed into an environment filled with uncertainty, long hours, staff shortages, and overwhelming patient loads. Hospitals and clinics were flooded with patients, while doctors had to constantly adapt to new guidelines, safety protocols, and rapidly changing information about the virus. But the challenge didn't end when infection rates began to fall. One of the biggest consequences of the pandemic is the massive backlog of delayed medical care. During lockdowns, millions of appointments, screenings, and non-urgent procedures were postponed. Now doctors are trying to catch up with years of delayed diagnoses and treatments. At the same time, the pandemic triggered a surge in mental health challenges among patients. Family doctors are now seeing more people struggling with anxiety, depression, burnout, and stress-related conditions. These cases often require longer and more complex consultations, adding even more pressure to already packed schedules. For many physicians, the pandemic became a turning point. After years of extreme stress and emotional strain, some doctors decided to reduce their hours, retire earlier than planned, or leave medicine entirely. Others are choosing not to accept new patients because they simply cannot handle a larger workload. Even today, the healthcare system is still trying to recover from the shock of COVID-19. And until the system fully stabilizes, its ripple effect will continue to influence doctor availability and patient care across the country. Before you go, we'd love to hear from you. How did the pandemic affect your experience with healthcare? Share your story in the comments. And if you value the time and research behind these videos, please subscribe. It's one simple click that truly helps us keep making content like this. When you look at the numbers, the situation becomes impossible to ignore. 5.9 million Canadians without a family doctor, and more than half of physicians considering quitting or reducing their hours. These aren't just statistics. They represent millions of people who may struggle to access basic health care when they need it most. As we've seen throughout this video, the problem isn't caused by a single issue. It's the result of multiple challenges happening at the same time. Doctors are facing burnout, overwhelming paperwork, and increasing patient complexity. The population is aging rapidly, which means the demand for medical care continues to rise every year. At the same time, too few medical school spots, fewer graduates choosing family medicine, and a wave of upcoming retirements are shrinking the number of doctors available to meet that demand. On top of that, rural communities are struggling to attract physicians. Internationally trained doctors face barriers entering the system, and the aftershocks of the COVID-19 pandemic continue to place pressure on healthcare professionals. When all of these factors combine, the result is a healthcare system that is under more strain than ever before. But despite these challenges, there is still reason for hope. Many experts believe that solutions exist, such as expanding medical training, improving working conditions for doctors, reducing unnecessary bureaucracy, and creating faster pathways for qualified international physicians. With the right reforms and support, the healthcare system can become stronger and more sustainable for the future. Because at the end of the day, healthcare is not just about hospitals and policies. It's about people. Doctors who dedicate their lives to helping others, and patients who rely on them for care, guidance, and reassurance. The real question now is, how will Canada respond before the shortage grows even larger?